You're most welcome. I'm called Doreen Amito. I work here in St. Mary's Hospital, Lacor, in the postnatal clinic and family planning clinic, where we look at the well-being of you, the mother, and your baby after delivery. We checked to see if you have any problem, then we send you to the doctor to see you. If you had a normal delivery, if we don't find any problem, then we send you home. For those who were done operation, regardless of whether we get a problem or not, we still send you to the doctor because the doctors would want to see if that wound is really healing well the way it is expected. Remember, they are the one who operated you. So we always checked on you from day 6 after delivery. We expect you to come here. Also at 6 weeks, we also want you to come back here, and we checked on you at 6 months. At 6 months, also we checked on you. Then time and again, also issues of family planning, we discuss with you from day 6 until 6 months. After delivery, just like during antenatal clinic, you were always told the danger signs during pregnancy. And then during labor, when you go there, also the midwives there do talk to you. They tell you how you should behave during labor. The same thing we carry out during postnatal. After delivery, we continue to check on your well-being. We want you to know that after delivery, there could be some danger signs if you go home, which we want you to note. And if you find that that thing is happening, you need to come back to hospital immediately. You don't have to stay at home. For example, you could be having severe bleeding again after delivery. Sometimes maybe if you're having body swelling all over, you need to come back to the hospital. When you have headache and you feel maybe like you're blurring, you cannot see well, you have a blur vision, there you are not able to see things well. And then also, when maybe you have problems with the breast, you have swelling on the breast, maybe your breast is discharging pus, blood is coming out of your breast, these are not good signs for you who has delivered. Then also, when you have severe abdominal pain, you have back pain, and for those who are done operation, if that wound is discharging pus, if you see blood coming out of it, the wound is swelling, you see the wound is trying to get open, all these are bad signs. You need to come back to the hospital and you don't have to stay home. If also you have maybe rapid palpitation, you need to come back. Headache, remember, can be a sign that maybe you have malaria, maybe you have pressure. We have a pressure. There is a pressure that usually gets a pregnant woman only. It may get you when you're pregnant, maybe when you come in labor. Also, after delivery like this, when you come, you could be found to be having such a pressure. So headache could be that sign, or any sign of any other illness. So you don't have to ignore. You need to come back. These are signs for you, the mother. And then also, during the postnatal period like this, we want you to keep your personal hygiene, just like also during pregnancy. Because after delivery, there is risk of infection. So we want you to care for yourself well. In a day, as a woman who has delivered, you have to bathe at least 3 times with enough water and soap. And then also paying attention to your private part the most, because this time the mouth of your womb is still open. And in case of any infection, it could go half to the womb and cause you problem. So you need to be very careful. The pads that you're using, you need to change them very frequently so that it doesn't cause you infection. And then also you need to do postnatal exercise after delivery. We have simple exercises that you can do after delivery. Remember, during pregnancy, there is generally exhaustion of the body, even the brain is exhausted. So after delivery like this, you need to work out your body so that you get back to normal, to the state when you were not yet pregnant. So there are exercises like, yes, not only those who have delivered. If you have been done operation, of course, there are those exercises that are so tedious we cannot allow you do, but you can ambulate. You can move around. Moving around can help you to strengthen your muscles, and then it will aid the healing of your wound. Also, exercises like when you get a flat surface, you can also lie down on your back. As a woman who has been operated, you can still exercise on bed. You like lifting one of the leg up, and then the other one you can make it straight. Then you leave it for some time, and then you keep on alternating. So this one can help to exercise the muscles of your pelvis, the muscles of your leg, even if you are not standing up walking, and it can aid your healing of the wound. For those who have just delivered, they can continue doing exercise like also sit up they can do, whereby you can get a flat surface, you can put a mat down, and you can do the same like I've said for those who have been operated. And the sit up, you can also sit down on a flat surface, you can put a mat, then you sit and hold your head, and you lie down with it. You get up to and fro. You do it several times. This one will help to exercise the muscles of your abdomen, the muscles of your waist, and the legs. And you'll find that with time, you're getting back to normal. Then also, you can do the squatting exercise, whereby you can squat down and stand up. You can squat down and you stand up. You do several times. Also, remember during pregnancy, the way you're passing urine had changed. I don't know if you noticed this, okay? The way you're passing urine had been very frequent compared to when you were not pregnant. So after delivery like this, you really need to train the bladder to get back to normal. So when you go to pass urine, you don't have to pass the urine at once like you used to do. You should pass it in bit. When you start passing, you try to grip a bit, you hold on, and then again you release bit by bit like that. You can do this several times until the urine is finished. This one will also help to will help the muscles of your private parts also to get back to normal. Another thing also that you can do is, I said the brain is also exhausted during pregnancy. So you also need to have enough rest. You need to find time and rest during the day. At night, you have to make sure you're sleeping well and ensure that you are not worried so much. So we need you to be also supported by the people who are at home, like your husband. You need to get this support, or any other person staying with you at home, so that really you don't have so much worry. Because when you worry, also there is a illness that is only also for the woman who is pregnant. Like it may get you when you have delivered like this. It is a mental kind of problem which a woman who has delivered can get. So you need to avoid worry. We call it puerperopsychosis, whereby you may be confused. Sometimes you'll find that you're going to begin refusing your baby. So we don't want you to go to that state. That is why we want you to really avoid worries. This is the first thing. And secondly, remember, if you're worried, also breastfeeding is going to be affected. You have a baby, and this baby needs what? Breast milk to sustain it. So you need Yes, thank you for that question. Sometimes it depends on the mode of delivery, which the mother has delivered with. If maybe is a cesarean section, the mother was operated, you know, after the operation, you don't begin to eat immediately. So maybe the milk is not yet produced. That's why you cannot get. And another case maybe if this woman maybe was very sick, so immediately after birth, maybe she could not put this baby to the breast to breastfeed. So it becomes difficult for this breast milk to start coming, because it is needed that once a woman delivers, immediately after birth, and with us here in Lacor Hospital, we want within the 10 minutes of birth, this baby has to be put on the breast. And it is that putting the baby on the breast that will help the brain to know that this baby is now there and can begin to produce milk. So when we don't carry out these things, sometimes it can also affect the breast milk coming for the baby. However, naturally, for the first 3 days of delivery, always the breast milk is not yet very sufficient, okay? And it can begin coming in about the third day. But we have this first milk which has already been there even before delivery. Only that we don't notice. It is very little, but it's very important for the baby. So I've been talking about the danger signs in the mother after delivery. Now I want you also to understand the baby also has got danger signs that you as a mother, you should be aware. In case you notice such a problem, you have to bring the baby to the hospital and hurry, don't delay, because this one puts the life of the baby at risk. One, after delivery, you need to maintain the baby to be warm. Remember, where the baby is coming from is very hot. Like you see after delivery, when they bring the baby out, we hurriedly wipe the baby and then we put to your abdomen here. We want the baby to get that warmth from you. And then afterward, we want you to wrap the baby and continue. We, the health workers, and you, the mothers, we want you to continue maintaining this baby to be warm. Keep the baby warm most of the time. If you leave the baby uncovered like this, the baby can get chilled. We have a condition that is known as hypothermia, where the baby, you'll get the baby skin all very cold. The extremities, the hands, the legs are very cold, too cold. So this one is one of the conditions that normally kill newborn babies. We want you to protect the baby from coldness. Then also another thing after delivery, we want you to keep the baby clean, just like we talked about your hygiene. Also the baby, you need to bathe this baby in the morning and in the evening, and also paying attention to weather. Sometimes you wake up when the weather is very cold. Please don't hurry to bathe this baby. You can even bathe your baby once. If the weather is too cold, bring the baby. Just what you can do, if the baby has passed urine or stool, just wipe the buttocks of the baby to keep the baby fresh. And you wait when the weather is warm enough, then you can bathe the baby. And the other thing is keeping the baby to feed well. And the feeding of the baby we know is breastfeeding. So ensure that your baby is always breastfeeding well. And breastfeeding well starts with you, the mother. Are you eating well? What are you eating? After delivery, we expect you to eat all the varieties of the food that you have been eating before. We have some foods that will help to build your body. There are those ones that can give you energy. Then we have those ones that can protect from diseases. So among us, the food, like those ones that can build your body, we have food which we can get from animals, like cow's meat, goat's meat, chicken, eggs. And from the garden, we can get beans, for example. And then also, we have this one that can give you energy. We have things we call posho, okay, where you get cassava, potatoes, rice, to mention. Then this one that can protect you.
What of those mothers, like my wife was operated,
Yes.
Now, like they say soft diet, and I'm only buying for her eggs and eating Irish.
Yes, thank you for that question. For the mothers who have been done operation, I know there has always been that fear of eating. These are some information that they can even get from their colleagues. But it is advisable to eat whatever you have been eating even before you were done operation. You are advised when you have just been brought back from the theater, there you survive on the fluid that we give you, like for 6 hours only. And then after 6 hours, you're expected to start taking some fluid. In the next day, you can begin eating this soft food that you're talking about. But by the time you're being sent home in 3 days, you can begin eating the normal diet that you have been eating. But the only difference is going to be that you're going to be eating very small, but many times, frequently. Okay? Not like the other people are eating.